Right, good evening everybody, and thank you for taking time out of your busy evening to join us for tonight's webinar being hosted by AHDB Beef Lamb. My name is Katie Bryan. I'm the Better Returns Programme Project Manager at AHDB Beef Lamb, and tonight I'm delighted to bring you the webinar on successful calving. Our presenters this evening are Alwyn Jones and Basil Lowman from SAC. The plan of action is Alwyn and Basil will run through the presentation, and then there'll be time for comments and questions at the end. You will all stay muted throughout the presentation, but if anybody has any questions you'd like to ask throughout the presentation, there is a questions box on the right-hand side of your screen. If you type your question in there at any time through the presentation, we'll endeavour to get as many questions answered as possible throughout at the end of the presentation. Tonight we have a very large number of producers. There's nearly 200 producers registered for tonight's webinar, so if everybody asks a question we might not be able to get them all answered. You know, and basically I'd like to thank Ben, who's working behind the scenes to hopefully keep this running as smoothly as possible, but if we do encounter any technical difficulties, please bear with us, but we'll try and keep these to a minimum. So without further delay, I'd like to introduce Alwyn and Basil. Alwyn Jones is the Veterinary Investigation Officer and Dr. Basil Lowman is the Senior Beef Specialist at SAC. We've worked with both SAC and QMS to develop this resource, as there are still large losses and problems caused by calving issues, ultimately by untimely interventions. We hope that the webinar will provide you with useful information to help you back on your farm at home. So without further ado, I'd like to pass over to Alwyn and Basil, who will share their presentation with us, and as I mentioned, if you have any questions, if you pop them in the box on the right hand side, we will ask them to Alwyn and Basil later. So over to you, Alwyn.
Thank you, Katie, and good evening, everybody, and thank you for joining us this evening. As Katie said, my name is Alwyn. I'm a veterinary investigation officer here at St Boswell's in the Scottish Borders. Been here now for about 4 years, and before that I was a vet in practice, in mixed practice, for about 5 years. And I'm here with my colleague Basil Lowman, who's one of our senior beef specialists with the SSC. So we're going to do a sort of a tag team approach to this presentation tonight. I'm going to start, Basil's going to take over for a little bit, and then I will finish the presentation off. This is a presentation we've been working on now for about well over a year, and we've delivered it a few times locally, and my colleagues have delivered the presentation in locations over Scotland as well, and we have had good feedback, and people have found that they have found that it's some useful take-home messages that they can apply, and practical take-home messages. And it was born from the fact that the reality is that perinatal, so calf death around calving continues to be a major source of loss in herds. And although there are a lot of obviously different causes, difficult calving continues to be a major factor. And also, interestingly, and an important point is that 90% of calves that are dead at the time of calving were actually alive at the start of calving. And this suggests that much of this loss is actually preventable. So the other reason for wanting to deliver this course as well was that we feel that people receive very little training in calving cows, so that I think there's a need to share what we know. We've gathered a lot of information and nuggets of information here from speaking to farmers and veterinary surgeons as well as reading the literature, and also taking things from human medicine as well. So hopefully you'll find a lot of useful practical information. And as I said, this is a very basic presentation. It goes about basic best practice, and we'll get on with it. So let's first of all consider the effects of a difficult calving. On a calf, a difficult calving, there's a greater risk of disease. primarily because after difficult calving, a calf is often low in oxygen and the blood becomes acidic, and that has an effect on the ability of the gut to be able to absorb antibodies from colostrum. And as the result, the calf, if there's a failure or a decrease in the ability of the gut to absorb colostrum, there is an increase then later on, increased risk of pneumonia and diarrhea and greater risk of disease in general. Also, a calf that's undergone a difficult calving is less able to regulate its body temperature, and as such is more susceptible to chilling and hypothermia. And as I said, it has a reduction in its ability to absorb colostrum. And then the effect of difficult calving on the dam is that there is an increase in fertility losses, so it takes longer to get it back in calf, if at all, increased culling rates in some cases as well. Now I'm going to hand you over to my colleague Basil, who's going to talk about preventative measures. We're not going to go into detail on preventative measures, but there are a few areas we feel are worthy of mention, and I'm going to hand you over to Basil now to do this part.
Good evening and welcome to this jamboree. What I would like to talk about just for a few minutes is things we can do to minimize the number of calving difficulties we have. And to do that, we really need to set ourselves some targets. And I can't use computers, but it will sort itself out in a minute and we'll arrive. There we are. Okay, so my target for assisted calvings, it's down the way, yes, is 0. Now, you might say that's daft, but really, if we have any difficulty with calving cows, it's a disaster to the cow, it's a liability to the calf, and it certainly doesn't assist our profitability. So really, I think we've got to set ourselves a very high target of 0 calving difficulties. The next thing is the cow is calved unassisted, and we need the calf to start trying to stand up within 5 minutes of being born. That's what nature's designed them to do, and that's what they should be capable of doing if they've been born easily and are reasonably sensibly bred and their mother reasonably sensibly fed. The final target I have is that the calf should start suckling by the time it's within 15 minutes of being born. So those are the 3 targets I've set ourselves, and of course the importance of suckling within 15 minutes is to get sufficient colostrum down its throat and sufficient antibodies to give it resistance to diseases. So there's 3 key areas to me in achieving these targets, and the first one is, of course, is the breeding of the animals involved. Now, basically we've got two parents involved, the bull and the cow, but most of our genetic improvement is achieved by our purchasing of the bull. And nowadays, we're very lucky to have what our grandfathers didn't have, is these things called estimated breeding values, which are an estimate, as they say, of how that bull will breed. And the EBVs we're particularly interested in tonight are the calving ease EBVs. And these are available on 99% of bulls from nearly all breeds throughout the UK. So we're very lucky to have this information available to us. Now, unfortunately, it's a little bit complicated because we have 2 calving ease EBVs. The first, and perhaps the most common one that's talked about, is calving ease direct. And this is a measure of factors which influence the calf itself, i.e. how big it is, how heavy it is, the shape, is it very muscular and what have you, and all the effect that has on how easily it can be delivered out of its mother. So these are factors influencing the calf, and I like to look at this as a ball and a hula hoop situation. Calving ease direct determines how big my ball is. Now the second calving ease EBV we have is calving ease maternal, or in another system called daughter calving ease. And this is a measure of factors influencing how easily the cow can deliver that calf. And one of the main things here, as we all know, is the pelvic area, the size of the cow's pelvis. So if you like, calving ease direct is the ball, calving ease maternal is the hoop. Now, if we have a big ball and a small hoop, we're going to have calving difficulties. What we want is an average size ball and a huge hoop, then everything will be born very easily. So we want high positive values in the bulls we're selecting for both of these calving ease EBVs. Now, if we look at a calf being born, here's a nice little calf just ready to pop out of its mum. Now, the effect of the sire of the calf inside the cow, we're only interested in the calving ease direct of this bull, because that will influence the size, shape of that calf, and how easily you can pop out. When we come to the sire of the cow who's giving birth to this calf, then still we want that sire must have a high calving ease direct, because half of the genetics in that calf come from its mum and half come from its dad. But in addition, we want that bull to have a high calving ease maternal. That will give us a big pelvic area and minimize our calving difficulties. So we're very lucky now in genetics, we've got the tools to try and minimize, if not avoid, calving difficulties. Now, the second thing I want to talk about is how we feed the cows, and in particular their condition at calving, and in particular how fat they are. We all know that the fatter cows get, the greater the calving difficulties they're likely to give us. And that is mainly due to fat, extra fat being in their body, first and foremost within the pelvic canal, reducing the size of the hole the calf can be born through, but also a lot of fat deposition intramuscular in the muscle of the cow, so that she's not as fit, tires more quickly, and doesn't get on and calve and get the calf out safely. There's relatively little effect in terms of cow condition on calf birth weight. Okay, and the critical thing is, once we get above a condition score of 3, then you can almost guarantee an awful lot of calving difficulties. So what's wrong if that's the relationship, that the fatter the cow, the more difficulty? What's the problem of just having them all very thin at calving? And there is a problem to that, of course, because if cows are thin at calving, a few weeks later we expect them to be mated and to rebreed again to keep a nice compact calving period. And the thinner the cow, the more likely she is to become anestrous, take a long time post-calving, and still she starts cycling again. So what we're trying to do is to juggle with these two ends of the extremes. So the ideal body condition score at calving depends on when cows are calving. If we look at a spring calving herd, then we're talking somewhere about a condition score of 2.5 or perhaps slightly leaner. And that is because we want to get cows calving easily, knowing that soon they will be turned out onto spring grass, hopefully ad lib. They'll be gaining weight rapidly, if you like, they'll be flushed, and therefore we should still have good fertility. In comparison, in autumn calving herds, then we want the cows to be in better condition at calving. Although that could possibly slightly increase our calving difficulties, we need that extra energy on the cow's back to make sure she does get back in calf again quickly, even though she'll be on winter rations and perhaps even losing a little bit of body condition over the mating period. So those are the target condition scores we're looking for. The final point I want to talk about is actually the contents of what we're feeding our cows prior to calving. And the one which is very easy, very simple, is extra magnesium. And the advantage of extra magnesium at that time, and we're talking about perhaps an extra 30 gram per day of a high magnesium mineral, is it improves muscle tone and it actually makes for a wetter calving. Now, a lot of you might have come across these things of slow calving cows. They sit down, squeeze a bit, then get up and turn around and just keep on and on and on, don't go anywhere very fast. Part of that is due to poor muscle tone. Magnesium is extremely important in terms of maintaining muscle tone, and keeping a fit cow can really thrust these things out. Also, personally, I believe it gives you a much wetter calving, and I think, you know, if you get near a cow calving, your Wellingtons should fill up pretty quickly with lots of fluid. The other component we want to look at, we think, is actually the protein content of the diet in that last couple of weeks before the cow calves. And really, we're just using what the sheep people have been using now for a few years, is we're suggesting that we feed extra DUP, digestible undegradable proteins such as soya, to help ensure the quality and the quantity of the colostrum where the calf is getting after it's been born. Now, so our recommendation there is to feed about ½ kilo of soybean meal extra, and both of these things I would introduce to my cows starting about a fortnight before calving is due to start. Now the final thing is just really a bit of interest, because one of the problems is we always seem to get calving difficulties at night, but there's nobody to help you, the vet's in bed and heavens knows what. Everything is just a lot more complicated to do. And we looked at some American work, this is 10, 20 years ago now, we looked at when we fed cows and how that influenced when they calved in the 24 hours of the day. And we took our day that we expected the people to be up, 6 o'clock in the morning, out of bed with their trousers on, and while we didn't expect them to work all day long, we did expect them to go to bed at 10 o'clock at night and have 8 hours sleep. We didn't ask who with or anything like that, but that's how we defined our day and night period. And we went to 6 herds and we split them into 2, and half of them we fed normally 8, 9 o'clock in the morning. And when we did that, we ended up with 57% of the cows calving in our daytime, and just under half of them, 43, in what we considered night. And obviously, if some of those 43 have difficulties, it's all pure hassle, lower levels of observation, etc. Now, if we look at the other half of the cows in the herd, those, we just changed the feeding to 10 o'clock at night. Now, we didn't actually go out and physically feed them at 10 o'clock at night. We shut them off from the feed trough at about 4 o'clock in the afternoon, filled the troughs up with silage, etc. When we went out at 10 o'clock at night for our last look around, we opened the gate, let the cows into their feed. And by doing that one simple thing, we increased to nearly 80% number of cows calving in the daytime and reduced the ones calving in the middle of the night down to 21%. And again, it's reducing the risk of animals having problems when we're not there and we haven't got all the resources available to handle them. So I'll now hand you over to Alwyn, who will go on to what you do should you have a problem. But remember, every time you have to calve a cow, think, why am I having to do this? What have I done wrong? How could I have prevented it?
Thank you very much, Basil. Okay. Okay, so let's consider the stages of normal calving before we get into the nitty-gritty of calving cows, etc. Calving is crudely divided into 3 stages. So because stage 1 is basically the beginning of delivery, and it's characterized by relaxation of the cervix and relaxation of the uterus, and contraction of the uterus. And typical signs of cows that are in the stage 1 of calving are that they're seeking isolation. They might show signs of discomfort and pain, so they might lie down and get up repeatedly. They might kick at their belly, swish their tails. Discharges from the vulva tend to become more liquid. The contractions may force some cows to arch their back and strain slightly, and the weights might be shifted from one leg to the other, and also the other quite common one is they have an extended tail as well. And stage 1 ends, strictly speaking, when the calf enters the birth canal. So that's and at the start of stage 1, the uterus contracts every sort of 15 minutes or so, and then by the end of stage 1, it contracts every 3 minutes or so. Now, stage 2 is the actual labor, and it lasts sort of between half an hour to 4 hours, and at this time the cervix is fully open, and the presence of the calf in the birth canal stimulates the release of a hormone called oxytocin, and that in turn stimulates strong contractions of the uterus and forceful contractions to push the calf out. And normally you will see a series of short presses or short abdominal presses followed by a short period of rest, and that's normal. So the rest is usually 5 to 10 minutes, and then they have another go at it. And usually following delivery of the head, then there might be another short pause while the cow takes a bit of a rest before starting again, and then another big effort is needed to get the shoulders and the chest out. And then third stage of calving is once the calf is out, stage 3 is expulsion of the afterbirth, and this should occur within 12 hours. So let's consider how do we determine when a cow will calve. Now, if I could speak to you here, I would ask you questions, and I would be interested to hear how you determine how you determine when a cow will calve. But it would be great if you could tell exactly when a cow will calve. This would avoid this intervening too early and also intervening too late, and it would reduce the risk of calf death and also injury to the cow. But unfortunately, the time of calving remains difficult to predict, and let's first consider just what we can see and feel on a cow. This progressive relaxation of the ligaments around the pelvis. So there's one diagram on the right here shows you what I mean by the pelvic ligaments, and the relaxation of that causes a pelvic bone to drop. And the photograph on the right with the arrow also indicates points to the pelvic ligaments, and when you see that, you see dropping of the tail head as well. So I would say it's probably the most commonly recognized and commonly used sign that calving is in the near future. Now, up to calving, there's relaxation that occurs in the pelvic ligaments of about 2.5 centimeters or so over several days. However, immediately before calving, a further relaxation occurs, and it relaxes by a further sort of 2 inches or so. And if you want to become scientific, but if you were to measure this drop, they have shown that when the drop is 5 millimeters or more from the preceding day's drop, then calving is sort of almost 90% certain to occur within 24 hours. However, that is totally impractical, but it's this progressive relaxation of the ligaments is probably the most useful indicator of when calving is likely to occur. The other changes that occur is cervical opening, and once this has started, calving is quite reliably going to occur within the next 24 hours, but it could be as little as 6 hours in mature cows. But again, this is quite an invasive procedure. You have to get a cow in and put your hand in, and that is not a practical solution. Other indicators include relaxation and enlargement of the vulva, tenseness and filling of the teats, but I mean that may begin several months before calving in heifers, and may not be obvious in cows until the last week. The other thing is changes in temperature and changes in body temperature as well, but actually, again, quite an invasive procedure, but has been used and can be helpful. Now, technologically speaking, there are a couple of other alternative options or sort of aids to help you determine when a cow is likely to calve, and they detect changes that occur in the cow before birth, and one of them measures tail movement patterns, and when they reach a certain level or intensity over time, it sends you a text message direct to your mobile phone, and there's usually you get your text usually about an hour before calving is due to start. And then another device is one that's placed actually inside the vagina of the cow about a week before expected dates of calving. And then this one measures the cow's temperature. And then about 48 hours before calving, the animal's temperature drops. I'm sorry, no, the temperature peaks and then starts to drop again. And this sensor will detect this change in temperature and send you a message to your mobile phone. And then at the start of calving, when the water bag expels its fluid, it sort of pushes this device out at the same time. And then there's another drop in temperature, obviously because it goes from inside the cow out onto the ground. And then you get another text message. And then this usually indicates that calving is probably going to occur in the next 2 hours or so. So you get a 48-hour alert roughly and a 2-hour alert roughly as well. So, and we know of herds that have used these successfully and have had a lot of success with these. So when do we intervene at calving? Now this is, again, I would be asking you this question if I was in the same room as you, because I'm quite interested to hear of your methods of deciding what you look out for, how do you decide when it's time and when a cow needs somebody to intervene when she's calving. And we've come up with these 5 sort of rules of thumb, if you like, and we believe that if a cow has been in first stage labour for over 8 hours, now caveat with this is that to know that it's been 8 hours, you know when she first went into first stage of calving. So if you're not checking the cow every sort of couple of hours, you know, this is going to be very difficult to know exactly when she's gone into first stage of calving. But if you do know, then and if you've got a fair idea that she's been in first stage labour for over 8 hours and there's nothing progressing or no calf, or she's not gone into stage 2 of calving, so i.e. she's not showing signs of forceful contractions, then you need to intervene. The second one is the water sac has been visible for 2 hours, but the cow is not trying. The third, and also if the fetal feet, so if the calf's feet, or the other one is if the calf's feet has been seen, or you can see the calf's feet, and they've been there for 2 hours, and the cow is not trying, then that's called the 2 feet 2 hours rule. Is something that some people have called that rule, sort of a memory aid for that. The cow has been straining for over 30 minutes, but it's not making any progress. We believe after the 30-minute period of straining, the calf should be coming closer and coming closer all the time. The fourth one is that she stopped trying for 15 to 20 minute period of progress. Now, as I mentioned briefly in a normal calving earlier on, it's normal for a cow to have a period of contractions and then a break, and then to start contracting again. And usually that period of contractions, that break period usually lasts about 5 to 10 minutes. Now, if she stopped trying and that period of break exceeds 5 to 10 minutes, so it's 15 to 20 minutes after the period of progress, then that's another indicator that you need to intervene. And finally, any signs of excessive fatigue in the cow, you can see the calf's head is swollen, the tongue is swollen, or there's an excessive amount of blood, then that's another indicator that you need to intervene. Now you decided you're going to intervene. The first thing to consider is hygiene, and it's basic principles, but it's quite important, and you want to try and prevent uterine infections, post-calving uterine infections, endometritis, and a sort of difficulty in getting the cow back in calf next time. So if you are going to intervene, tie the tail to the side, clean around the anus, clean around the back end, clean around the vulva. If there's any protruding calf parts, quite often there's feces on there. So clean them off. Wear gloves or wash your hands and arms. So I use these sort of as a picture, rectal gloves here, and make sure there's clean and dry bedding. So when the calf arrives, it lands onto clean, dry bedding. Secondly, is to use lubrication when you're intervening, and to remember to use lots of it. You know, it's relatively cheap, it's non-harmful, and it's quite readily available. And we believe that it's important that you use lubrication right from the start, not when things become stuck or difficult, because that's the tendency to start off by not using any lubrication, and then you get to a difficult point when the calf is, you know, the chest or something's coming through the pelvis, and then trying to get lubrication between the calf and the birth canal at that time. It's incredibly difficult, and most of the lubrication actually just falls on the ground at that point. So, but if you'd have taken lubrication in with you from the start, then there is a much greater amount of that lubrication is going to be present where you want it. And it's worth just pointing out that you can get powdered lube, and basically you mix that with water, and it does go a long way, and with very little powder you can make a bucket full of lubrication, really. And we have, I mean, certainly in the horse world, where when mares are foaling, people or equine vets will almost sort of pump lubrication buckets, or a whole bucket of lubrication, if you like, made with this powdered lube, into the uterus with a stirrup pump, just to fill the uterus with, within reason of course, but fill the uterus with lubrication, because the equine uterus is such a delicate structure. And then a great tip we had from a local practitioner was he was using an old calf stomach tube, and obviously one with still with a smooth end, but he would use this calf stomach tube. So you'd make up a bucket of lube, if you like, with this powdered lube, pour it into the bag, and use it to siphon it into the uterus if there was going to be a difficult calving. So we thought that was a great idea, and a good way to get a lot of lubrication in there, and to the place where where you want it, and not on the ground. And a note here on, if you are intervening, and first of all just putting your hand in, it's important to put your hand in and assess to see what's going on, and try not to burst the water sac. So in this case I'm talking about the second water sac, and the second water sac is, as in the picture here, this is sort of a grey, bluish grey coloured sac that encompasses the calf, and it's a sac that keeps the fluid around the calf. And when you put your hand in, and you're due to calve, to feel what's going on, and if you don't think the calf is ready to come out here, then try not to burst that water sac, because that sac keeps the fluid around the calf, and that fluid keeps things mobile, you know, keeps things lubricated. Obviously, if you think it's time to pull the calf, and you want to use a jack and put the calving up, and then you will have to burst that water sac, and the water will come gushing out. So you'll need to get the feet then, you know, without any sheath around them, so you can put on your calving ropes. So first of all, we do recommend that before you decide to do anything, put your hand in, and try and assess what's going on, to have an idea of the position of the calf, how difficult the calf is like to be. Is the calf alive or dead? Is it likely you're going to need help? Is it going to be a cesarean job? Are you going to have to cut, you know, you're going to have to get the vets out to cut the calf up, or is it a live calf? But first of all, put your hand in and just feel around the birth canal. Does everything feel normal to you? Does it feel particularly narrow? Is there any protruding parts at all? Do you think it's wide enough to allow passage of the calf? Assess the cervix. You know, does the cervix feel particularly narrow? I mean, the cervix should be big enough to allow passage of the calf, but I would say, you know, you should easily be able to get 2 of your fists in width. It should be, the width of the cervix should be at least twice the width of your fists. If it's particularly narrow still, one thing you could do is wait half an hour, so reassess in half an hour, and if there's been any change, you know, if it's opened up a bit more, then great, so then maybe give it another half an hour. If there's not been any change, then she might be suffering from a condition called, well, narrow cervix, and that can be well, it can be due to environmental stress before calving. You know, it can be due to hormone imbalance. And the other thing, it can be sometimes difficult to distinguish between a narrow cervix and a twisted uterus as well. So that's another thing to bear in mind if the cervix feels particularly narrow. And in a situation where you've got a twisted uterus, you need to intervene relatively quickly, and it's important to try and identify whether it's a twisted uterus quite early on. Then assess the position of the calf. Is it coming frontwards? Is it coming backwards? That will sort of influence your approach to applying traction onto the calf. Is it the right side up or is it upside down? And if it's upside down, then it'll need to be corrected the right side. You know, that will need to be corrected before you start to pull. And is it in the correct position? So are the legs and heads, how are the legs and head orientated? So have you got a head back? You got one leg back, etc. And then try and determine if the calf is dead or alive. Pinching between the hooves of the front feet if it's coming frontwards, or the back feet if it's coming backwards, or is a good way. And if it's alive, you should pull its feet back. If it's presented backwards, and if it's presented breech even, and you've only got a tail looking, you can put a finger up its back end, and if it's alive, then you should feel contraction around your finger. And then other ones you put 2 fingers in its mouth, and a live calf would sometimes suckle or suck your finger. And the other one is a blink reflex. So you can gently tap on the corner of the eye, and you might feel a blink reflex as well. So those are some ways you can use to determine if a calf is dead or alive. So you've decided that you're going to try and deliver the calf with traction, and then everything is looking favorably. I mean, some other predictors, if you like, of a successful delivery, and the calf is probably not too big, are that when the cow, you can see the calf's feet, see, and when the cow strains, you can see the hooves sliding or gliding back and forth. So when the cow strains, the hooves are seen to glide out a little bit, and then when she relaxes, they seem to glide or seem to slide back in again. So that gliding suggests that the calf is probably not too big. Secondly, if the head has been brought into the birth canal without any assistance, and the fetlocks have been brought beyond the vulva without any assistance again, then that's a good sign. And I'm going to just jump one slide here to show you. I've got 2 slides, sorry. That you'll know that the head is in the birth canal. Head and shoulders are in the birth canal when the fetlocks of the calf is 1 hand's breadth outside the vulva. So you can, I hope that diagram here illustrates that. So I hope you can. That red arrow is located just below the fetlocks of the calf. Now, if they're about a hand's breadth outside the vulva, then it generally means that the head and shoulders are actually inside the birth canal, and that's a good sign, and there's a good sign that there's a relatively good chance that the calf can be delivered by traction. And jump 2 slides back. The final one is the head and shoulders are in the pelvic canal or in the birth canal, and you can fit your hand above the head easily. So that's another good sign. If you can fit your hand above the head, then I would approach that with caution, and it might be that there's not enough room for the rest of the body to pass through. Jump 2 slides again. Okay. Now, some things to look out for that are warning signs and probably indicate that the calf is too big to come out. So she's been straining for she's been in second stage labor for 2 hours, etc., in first stage for 8 hours. So anyway, you decide you're going to intervene, and you find that the head is not in the birth canal, so the calf is coming frontwards. It's pointing the right way, the head is pointing the right way, there's no one leg back or anything, both feet are pointing forwards, but the head still hasn't been brought into the birth canal after the cow has been straining for over 30 minutes, and that's generally a bad sign. The calf is too big to get into the pelvic canal. Secondly, the front legs are crossed in the birth canal, so the calf is in the birth canal, the head is there, but then the front legs are crossed over each other, and that is a sign that the shoulders are being compressed too much, and it probably means that the calf is too big to come out that way. And finally, when the cow strains, so there's a portion of the calf so that maybe you can see the feet. When the cow strains, the calf doesn't move back and forth like I was describing in the previous slide, and we don't see that gliding back and forth. If the calf does not move at all when the cow strains, then it suggests that the calf might be lodged or stuck in the birth canal. So that's again a bad sign. But they're not absolute by any way, and in some cases, some calves might be deliverable even though they're showing these signs. But as a general rule, we think they are predictors that the calf is probably too big. So the next thing, you've decided the calf is going to, there's a good chance that the calf is going to be delivered by traction. So the next thing is placement of the calving rope. And we think the best way of doing this, in order to distribute the force you're going to apply onto the calf leg, is to take, and I hope this diagram sort of illustrates this well enough, is to fasten the rope above the fetlocks, and then take a half hitch below the fetlock as well, and that helps to distribute the forces. We recommend that calving ropes are used over chains. We feel that chains are can cause too much damage and a bit too aggressive. The downsides of calving ropes is that they are difficult to clean, but soaking them in water and disinfecting them immediately after calving and letting them dry out properly are ways you can overcome that hygiene issue. And then when you're applying traction, it's a good idea to pull one leg at a time until the shoulder have come into the birth canal, and then to pull horizontally. So looking at the diagram on the left first, to pull horizontally until the head and the shoulders are actually outside of the vulva, and then after this point pull in a slightly downward direction and using the jack, if you are using a jack, as for leverage. And I guess it's worth just making a note here and using a calving jack, and just to give an illustration of how much force a calving jack can apply. So if you think about the pressure that two people pulling on a calf is about 400 psi, whereas a calving jack can apply about well, nearly 2000 psi. So as you can see, so if it's used incorrectly and perhaps irresponsibly, then you can cause a lot of damage to the cow and to the calf as well. So that's something worth bearing in mind. Now, one point we like to make as well is a thing called the twist, and it's this idea that, and it's very important to bear in mind that the widest part of the calf is its pelvis, and the widest part of the cow's pelvis is diagonally across. So what we recommend is that before the pelvis of the calf passes through the birth canal or the pelvis of the cow is that the calf is twisted about 60 to 90 degrees sort of thing, so that the calf's pelvis passes through the cow's pelvis in a diagonal fashion. And I hope the diagrams are not too confusing, but the diagram on the left illustrates the oval shape of the cow's pelvis, and the middle diagram illustrates the calf pelvis and the widest portion of the calf's pelvis. And then the idea is by rotating the calf, you are, and so the calf's pelvis is diagonally across, it fits through the widest part of the cow's pelvis. And really you need to start thinking about rotating the calf as soon as the shoulders are out, really. And ideally, you, especially if you're using a calving jack, an extra pair of hands is very useful in this situation, because one person just to hold the jack in place and to control that, and the other person to wrap their arms around the chest of the calf and apply and try to twist the calf a little bit, because it's better to apply that twist before the calf's pelvis gets into the birth canal, as opposed to trying to twist the calf once the calf becomes hip lock. So it's sort of a preventative, sort of a just in case measure. I mean, in some cases, even if you don't apply this twist, the calf will probably pass through okay, but we think it's a good measure to do that with every calving you're intervening with. And this is an illustration sort of showing you what I mean by twisting the calf. Now, once the pelvis of the calf enters the birth canal of the cow, if you think about the umbilical cord for a moment, which is attached, which connects the calf to the cow, or the cow to the calf, and then that umbilical cord delivers oxygen and nutrients which are essential for the calf's survival, and the calf will not survive without that. And when at that point, when the pelvis of the calf is in the pelvis of the cow, you get compression on the umbilical cord, because that you might be able to see on that diagram on the left is that the umbilical cord will be between the calf's belly, if you like, and the floor of the pelvis, or the floor of the cow's pelvis. And normally in a normal unassisted calving, quite often after the shoulders and the chest have come out, the cow will actually take a bit of a break at that point, and sometimes in some cases will actually stand up and take a bite to eat, and the calf is still hanging out there. But at that point, even though there's compression on the umbilical cord, the calf will start to breathe of its own accord, and it will take over from the umbilical cord and start taking in oxygen through its lungs, as opposed to relying on the umbilical cord. Now, in a difficult calving, it's worth, after the pelvis of the calf is in the pelvis of the cow, it's worth just taking a brief pause at that moment, clearing the nose and the mouth, and letting the calf take a breath or two before you finish pulling the calf. And that brief pause can make a lot of difference and reduce the chances of the calf being slow to get going and becoming acidotic, which I'm going to get into in a minute. So just a brief pause at that moment if it's still a tricky calving, only for a few moments. Let the calf have a breath or two, and then before carrying on. And because if you're going to keep applying traction and keep stretching the calf, then the calf is not going to be able to expand its ribs and take in oxygen the same way. So just relaxing a little bit, releasing the jack a little bit, letting the calf take a breath, and then carrying on with the process. So if the calf is coming backwards, the critical part is that the calf's hips must be able to pass through the pelvic canal, and you will know that the calf's hips are in the pelvic canal when the hocks of the calf have come outside the vulva. So that's one way of knowing that the hips are in the canal. Again, we recommend twisting the calf again. So in this case, if you present it with 2 feet, 2 hind feet, 2 back feet, rotating the calf 60 to 90 degrees, and then pulling the calf so its hips or its pelvis is coming through the cow's pelvis or the birth canal at a sort of a diagonal angle, and then it's the best method of pulling the calf is to pull slightly up from horizontal for some level, if you like. So pull in a slightly upward direction to start, and you can take your time at that moment. You can slow and controlled right until the tail head and the calf's back end, so the calf's anus, is outside of the vulva. Now, from that point onwards, then you're getting compression on the umbilical cord, and from any point from that point onwards, the umbilical cord will break. So you need to avoid delay after that point, and you need to pull the calf out as quickly as possible, really. And so if you, as I said, you start off in a slightly pulling in upward direction right until the tail head of the calf is out, and you can see its anus. And then after that, you pull in a slightly downward direction, and avoid delay, because you've probably got about 2 to 3 minutes from the time the umbilical cord breaks to avoid any major issues with the calf when it finally arrives, or even death. Okay, so it's been traction has been successful. The calf is on the ground, and now it's next part is to consider how we're going to resuscitate the calf if necessary. And this abbreviation ABC, that's for airway, breathing and circulation, that's quite often used in human first aid, is also quite applicable here as well. And so we're talking A for airway, B for breathing, and C for circulation. So first of all, consider the airway. Airway, an open airway for the calf to breathe and take in oxygen is clearly essential. So for us to establish the airway by clearing the nose and mouth of any sort of fluid, any sort of mucus and membranes from an under area. And there are sort of aspirators available, which some producers find very useful, some other producers not so useful, but they can help, to suck that mucus from the back of the throat and from around the mouth. The other thing that some people feel that do help is holding the calf upside down. Now, we've discussed and considered this quite a lot. This practice of holding a calf over a gate, and we've come to the conclusion that this is not the best way of doing this, and we do not recommend doing this. There's a couple of reasons why not. First of all, if you're holding a calf upside down, and if you think about the bar on top of the gate, putting pressure on the belly of the calf. Now, the pressure from the bar and the weight of the guts and the contents of its guts on the diaphragm or on the chest of the calf makes it difficult for the calf to, or makes it more of an effort for the calf to expand its chest and take in a breath. Another reason is that you can cause damage to the nerve that runs along the thighs, or the femoral nerve along there. So there's a risk of damaging to that nerve. Particularly, we have heard of stories of people who were hanging the calf over the gate and leaving the calf there for sort of 10 minutes or so, and to do another job, and that is certainly contraindicated. So we certainly do not recommend doing that. And finally, there's also risk of rupturing the bladder by doing that, because if you think about, again, the position of the bar when you're holding a calf over a gate, there is a lot of pressure on the bladder at that point. Instead, an alternative, and I think a very good alternative, is to use the calving jack again, and is to connect the calf's back feet to the calving jack, and then use the ratchet mechanism and the leverage of the jack to ratchet the calf up. And we feel that's a much safer way, and takes much less effort, safer for the calf, and yeah, it can be much more controlled as well, so you can lower the calf down much easier afterwards. Just bear in mind that quite often you see a lot of fluid come out when you're holding a calf upside down, but a lot of that fluid actually comes, in fact, I would say most of that fluid comes from the stomach of the calf and not from the lungs. A calf, when it takes its first couple of breaths, has a remarkable ability to, a calf's lungs has a remarkable ability to absorb fluid. So this idea that all this fluid is coming from the lungs is usually not true. Most of this fluid comes from the stomach of the calf. So I do agree it can be useful to hold the calf upside down in some cases, and if you are doing it, we recommend using the jack. Secondly, breathing. A normal calf should be breathing within 30 seconds of delivery. And then breathing is quite irregular at first, but it should soon settle to about 45 to 60 breaths per minute. And then ways to stimulate breathing, so the quite basic methods here is to put a straw up the nose, to vigorously rub the chest with straw, massage the chest with the front limb, or to pouring cold water as well over the head, over the ears can also help. Additionally, on a medical point of view, doxapram or dopram can be quite useful. Doxapram works by stimulating the center in the brain that controls respiration, so breathing, so stimulates the breathing center in the brain. And dopram comes in various forms, but the most common one is the drops, which you put the drops under the tongue, and quite often vets will use that after a difficult calving or after a cesarean, and that might be something worth having in your calving box, and have a word with your vet about that to see if you could maybe have a bottle or a container of that for these difficult calvings, because in some cases it can make all the difference. And then moving on to circulation, and here we're considering the acidity of the blood. But first, let's consider a normal calf. And a normal newborn calf should, in the first 5 minutes, be breathing regularly, is able to hold its head up without assistance, and is sitting upright. And if you don't have that, so if the calf is not doing all those three things, it could be that the calf is suffering from a lack of oxygen, and secondary to that, acidic blood. And you might have heard of people talking about acidosis. Well, acidosis is basically when the pH of the blood is too low, so the blood is too acidic. And acidosis develops because of a lack of oxygen and a buildup of carbon dioxide and lactic acid in the blood. And signs of acidosis includes, so before the calf is born, if you have a calf inside the cow still that is acidotic, so showing signs of acidosis, perhaps that is usually because maybe there's a twist of the umbilical cord, something like that, or it's taken too long and the calf is acidotic when it's still in the uterus. Generally, these calves, when you put your hand in, are quite erratic and are kicking a lot. And that's generally a bad sign. And if you do notice that and you do find that, then it's a good. There's a sense of urgency, and you need to get the calf out as quickly as possible for to have a chance of the calf surviving. And in a lot of cases, the calf in those situations I find don't survive. When the calf is out, signs of acidosis would be that the calf is repeating really what I've said before in the previous slide here, is that breathing irregularly after 30 seconds or more, or after a minute or so, and they're still breathing irregularly. There's a delay of over 5 minutes in the calf lifting its head and sitting upright. Otherwise, the calf may have a poor muscle tone, so that will present as a calf being quite limp. And when the another sign of acidosis is when you pinch between the feet, it's got a lack of or a very poor sort of withdrawal. So it's very lack of or a weak withdrawal reflex. So it doesn't really pull its leg back like a healthy calf should be doing. So those are signs of acidosis. And the consequence of acidosis is you get a reduction in calf vigor and this development of this dopey, slow calves, which I'm sure many of you have heard of or maybe come across of as well. So I would say by far the most common cause of dopey calves is acidosis. Secondly, it could be tends to cause a reduction in the strength or even the absence of a suck reflex. The calf just doesn't suck at all. And thirdly, as I mentioned at the start of the presentation, it reduces the ability of the gut to absorb antibodies in colostrum, which are crucial really for survival. And if you have failure of this, or even a partial failure, you do reduce the chance of the calf surviving long term. Now, there is a way of treating acidosis, and the idea is to correct the acidity of the blood. And the solution used is bicarbonates and sterile bicarbonates, and this has to be administered into the vein for it to be effective. First of all, it needs to be sterile bicarbonate solution, so it needs to be sodium bicarbonate in a sterile form. It needs to be administered as soon as possible after birth, and as it's an intravenous procedure or a drug that goes into the vein, then it's a veterinary procedure. Now, I would advise that if you do notice, 5 minutes after the calf has been born and it's slow to get going, that you give your vet a call to see if they could come out and give this calf an injection of bicarbonate solution into the vein. And we know vets and producers around here who we are in contact with have had good levels of success in bringing these slow calves around using bicarbonate into the vein. So, and the typical, the solution is to use an 8.4% sodium bicarbonate solution, and a safe dose is to use 50 to 100 mils of that into the vein, and to apply and to inject it slowly over 30 seconds or so. So it's so not to whack it into the vein very quickly. Is to take your time and inject it into the vein over 30 seconds or so. The other thing that might be beneficial for calves slow to get going is some glucose into the vein. And because many calves who are acidotic are actually also low in glucose at the time of birth, and the solution would be 10% glucose solution at a dose of about 3.5 ml per kilo. Again, that would have to go into the vein if you are using that, but that would be a safe amount and could benefit the calves as well, and improve the chances of survival. And then finally, but not to forget about the cow, to go back and check for any tears in the uterus. Administer pain relief. We do recommend that if you've had to intervene, to administer non-steroidal anti-inflammatory drugs, or such as Metacam, for example, could potentially be used to reduce the swelling, to reduce any pain. This, sort of helps a cow or heifer get going, start eating, etc. So we believe that it should be given in every case, particularly if it's been difficult calving and if you had to intervene. And finally, if the calf was moved from the place of birth to be resuscitated, then to return that calf to that place of birth, if it's safe to do so, obviously, but if it's safe to do so, return that calf to the place of birth, because the presence of the birth fluids around that area is very important in helping the calf, or helping the cow accepting the calf, particularly in heifers. So the presence of birth fluids increases the chances of the mother accepting the calf. And that's the end of the presentation. So if we're more than happy to take any questions. So yeah, but thank you very much for listening. And I'll hand over to Katie.
Thank you very much. We've had a few questions come in already. One of them is when they've had a big calf born and they've had to assist it, they've had problems with it breathing straight away, but then it seems to fade away and die. Would it be any help of them having sort of like an oxygen tank and a mask, or is this not practical, or is it impossible, that sort of thing? A hand pump? Have you had any experience of that? They have used the Depron drops, but they haven't really had any success with those.
Yeah, I wouldn't recommend getting an oxygen tank and mask. I think that the problem there is acidosis, and the best solution would be to discuss with your vet bicarbonate therapy, how you go about it, and even whether your vet could even teach you how to do it as well, because the sooner you can get the bicarbonate into the vein, the better. Even if you are able to administer, even if you're able to stick a tube down the windpipe and administer oxygen, air would be better than oxygen, really. I think in a farm or a non-farm situation, I would maybe suggest getting hold of one of these resuscitators, where you're applying a mask over the nose and the mouth, and are pushing air, if you like, using the resuscitator into the lungs that way. But bearing in mind, if you are using that, you need to make an effort to close off the esophagus. So if you think about the windpipe and the esophagus, which is a food pipe, runs just behind the windpipe, and feeling along the neck of the calf, you can quite easily feel the windpipe. It's more difficult to feel the food pipe or the esophagus, but just generally applying pressure roughly behind the windpipe will go some way to shutting off the esophagus. So if you are going to use these resuscitators to put air into the lungs, just making an effort to shut off the esophagus, because if you don't, then too much air will get into the stomach. You'll get ballooning, if you like, of the stomach, and that in turn, because you then get a gas-filled stomach, which will cause pressure on the diaphragm, and then sort of restrict the ability of the gut to expand. So I mean, I guess, yeah. So the thing, if you are going to, I would suggest using resuscitators and looking to using bicarbonate therapy.
And that links into another question that I've had of how soon does bicarbonate need to be administered? Obviously, especially if they need a vet to be doing it.
As soon as possible, really. But if you can administer it within half an hour, then fantastic. But it's still worthwhile doing sort of 2 hours later as well.
Okay. Someone else has said EBVs are good, but they are estimated between their own breeds. So obviously, yes, they are certain breeds, and they have also said that they found their Charolais are easier to carve than their Angus because different breeds are obviously changing their own breeds and then thinking that that's distorting the figures. But you can't, I know you can't compare between breeds, but they shouldn't be distorted on my views. I don't know what Basil's views are on that.
Katie, can you repeat the question, please? We had a bit of a technical issue there.
I think someone thinks that the EBVs can be distorted within different breeds. They can be distorted, but and obviously they're just mentioning that they're estimated, but obviously estimated breeding values are better than a complete guess and not knowing anything about the animals. But also I think it's just untrust with EBVs, if you've got a comment on that.
Yeah, there's two things. First of all, if you look at the breed effect, EBVs are breed specific. In other words, you cannot compare the EBVs for ease of calving for a Hereford with the EBVs of ease of calving for an Aberdeen Angus. They're two completely different separate schemes, and they're all based with the average for that breed. So if we take something like the Jersey, the easiest calving cow probably in the world, versus some other breeds who might be white, some of the more difficult calving breeds, you can't compare EBVs across breeds. So that's the most important thing. The second thing is how reliable are EBVs? Well, of course, unfortunately, there are nasty pedigree breeders out there, as there are in every industry, who try and fiddle things. But the value of EBVs is some of the information is due to the results on the animal itself, but the majority of the information is due to his relatives. And the vast majority of those relatives will be in other people's herds. So although I, as an unscrupulous breeder, might try and fiddle my calving results for my cows, if all the sons I've sold from my herd in the last 10 years are difficult calvings on other people's farms, they will put down difficult calving, and my bull will be penalised accordingly. So EBVs aren't perfect. There's no such thing as 100% guarantee, but they are surprisingly resilient, and it's extremely difficult to fiddle them.
Okay, thank you. Regarding changing the feeding time or when you're actually feeding the cows, someone's asked, should cows ever be without feed in the trough?
Yeah, I have no problems with cows not having feed in front of them 24 hours a day. If you look at cows in nature in a grazing situation, cows will not graze for much longer than 10 hours a day. So that means for 14 hours a day, they're sitting down, chewing the cud, gazing at the stars, and just resting. So there's nothing wrong with cows not having food in front of them 24 hours a day. But we should be meeting their requirements. And the problem in most calving difficulties due to nutrition occur from us being too kind to cows, having them too fat, and that gives them calving difficulties. So I think we do realise that, especially after good summers, of grass summers, cows will be housing good conditions. They were last autumn. And we need to slim them down a bit, ready for calving.
Okay. Can you give a calf an interperitoneal injection for glucose the same as you can for a lamb?
You might be able to. It might work. Yes, I suppose you could. It's not something that is I don't think it's hardly ever done. But I would be careful from the point of view of puncturing any sort of organs and guts by doing that. And I think the points, if you like, so the points you'd be using for in a lamb will probably be slightly different in the calf. So I would carefully consider before doing that. to be honest with you. And I think in a lot of these cases, I think the most important thing is bicarbonate into the vein, and blood glucose is often secondary. And if you can get colostrum into its belly quite soon as well, but then that supplies a lot of glucose in its veins. So I wouldn't necessarily go down the route of doing intraperitoneal glucose injections before speaking, considering it further, reading up on it, and discussing it with your vet as well.
Could I just put in there, one of the problems with Alwyn is he's a vet, and he has to be polite to other vets. I don't suffer from that affliction. If you look at dairy farmers, the majority of dairy farmers nowadays have been trained by their vets to do intravenous injections for control of milk fever in dairy cows, and I don't see any reason whatsoever why the IQ of a beef farmer isn't similar to the IQ of a dairy farmer. So I would encourage all of you to politely ask your vet if he could train you in how to do it, because in terms of acidosis, time is extremely important. You know, it's so much more effective doing it within the first hour of life than doing it 5 hours later. And we all know how difficult it is to get a vet on the place. You know, it often takes 2 or 3 hours for them to get there.
Does the bicarb need to be warmed to body temperature before it's given to prevent shock?
It doesn't have to, but it's a good idea to do that, yes. And I would certainly advise doing that, yeah.
Okay. How much colostrum does a calf need in the first few hours of life?
Well, there's 101 different recommendations out there. It all boils down to basically a lot. The figure I like is 10% of their birth weight. Now, if you take a birth weight, a reasonable birth weight of 40 kilos, that's 4 litres of colostrum, which is something over 8 pints. So it's a fair night's drinking. So my recommendation would be to give half of that certainly within the first 3 or 4 hours, and the other half within 12 hours. So, you know, you've got it in within half the day. But really, it's very difficult to give a calf too much colostrum.
Okay, thank you. Are some of the newborn calf supplements based on caffeine, such as red calf, worth giving?
Depends. If you want to go bankrupt quicker than you otherwise would do, I would say. No, I shouldn't think so.
Okay. If they're a purely grass-fed system, are you happy that spring grass gives them enough extra protein that they need, or do you think they need to be given extra protein?
No, I'm happy that spring grass is more than adequate in protein. What worries me considerably about that is it will also be extremely high in terms of energy. Cows will be probably gaining weight on spring grass, even in late pregnancy. And my concern would be the condition of the cows and over fatness. We know very well, if you look at the incidence of calving difficulties in spring calving cows, where halfway through calving, the ones still to calve are turned out to grass, is that calving difficulties, you know, increase as a percentage as calving progresses. Now, I'm not saying that all the late calving cows you have to calve, but as a proportion of the cows calving at that time, a lot more will need assistance, and that is due almost entirely to the condition of the cow.
Okay, and in your experience, do you think autumn calving herds have more calving difficulties than spring?
Yes, I think, you know, we all know that, and again, it's part of the problem with autumn calving herds of how do you control condition in late summer when they're outside at grass. I mean, some people go to the extreme of housing the cows and calving them all indoors and then throwing them out for 2 or 3 weeks before they rehouse them again, which to me seems an awful lot of expense. But I do honestly believe if you get the breeding right and you get cow condition right, then we should not be calving many cows. There's almost a competition developing in farmers up here that, you know, when did you last calve a cow? And I had a fellow in today sort of joking about it, and he only has 50 cows, I accept that's a small herd, but he has 50 cows, and he says he hasn't even seen a cow calve for the last 5 years. So it can be done.
Okay, and there's just one final question. Can you give the bicarb into the stomach? Would it help at all?
No, I would, and there's a good reason why you shouldn't do that, and that's because bicarbonates in the stomach will interfere and disrupt the if you like, the bacterial population that's already in there, the flora of the stomach. So you don't want to interfere with that because that's essential for making the colostrum clot when it's in there, and that's more important than anything. So the colostrum needs to clot in the stomach, and if you're going to be and they clots because of the enzymes and the bacteria that are there already. And if you're going to apply something very alkaline as bicarbonate into the stomach, you're going to disrupt that. Yes, and as a result, we don't recommend putting bicarbonate into the stomach. We have considered that, but yeah, we don't recommend that.
Okay, thank you very much, and thank you to all the questions. And sorry, we've probably gone a bit further over time than what we'd normally do, but I didn't want to leave any questions unanswered. So thank you very much for everyone for listening. We've had a great turnout, and a big thank you to Alwyn and both Basil for presenting. If anybody is interested, on the 9th of March we have another webinar on planning cattle parasite control for the 2016 grazing season, so you can sign up to that in due course. And thank you very much to everybody this evening, and I hope you have a great calving this spring. Thank you. Bye bye.